How are you, everyone? My name is Sane from Kenya. I'm here at GlenEagles Hospital, a Kenyan representative for the hospital, and I am with an urologist, and I want him to introduce himself. Tell us his name.
Thank you so much.
Yes, sir.
My name is Dr. Jitendra Jagtap. I'm a fellowship-trained urologic surgeon, and my specialty is laparoscopy and robotics with lasers. And we are here today to discuss some urinary tract issues. And over to you. Feel free to ask questions that you deem necessary.
Thank you, doctor. How old have you been in this specialty?
So we've been in urology for almost 15-20 years now. We're a team of 7 urologists who work together under Dr. Pradeep Rao, who's the head of the department for us.
Yes.
And we are cumulatively having an experience of more than 20-25 years in the field of urology.
Where did you go for your studies?
So both Dr. Pradeep Rao and myself, both of us, were trained at one of the premier institutes in India called as NPUH, which is Mumbai Parel Urological Hospital in Nadia, Gujarat. And it is the preeminent center to train in urology in the country.
Yes.
And I did my endourology fellowship at the same place as well.
Yes.
Both Pradeep and I are also fellows of the Royal College of Surgeons of Edinburgh.
Good. What is the role of urology in surgery?
So, main thing which you need to understand is that a urologist not only deals with urinary symptoms, but even other organ systems like kidney, prostate, testes, and in case of female urology, problems which have to do with urinary incontinence. All these are managed by urologists.
Yes.
And last but not the least, kidney transplants are the foremost in terms of the different urological problems we treat.
Yes. Wow. Doctor, let's talk about the urinary tract issues.
So, there are multiple issues which we treat as urologists. We treat a lot of patients that I just described to you with kidney failure by doing transplants for them, by doing arteriovenous fistula formation for hemodialysis. We also do peritoneal dialysis catheter replacements. These are all the things we do along with our nephrology team here.
Yes.
And apart from this, we are one of the leading centers for management of tumors and stones in the urinary tract.
Yes.
So we treat stones with lasers. So there are no big cuts or there are no big incisions.
This is what we call kidney stones.
Yes. So you can get stones in the kidney, you can get stones in the bladder, stones in the ureter. We deal with all of them with lasers.
Yes.
We have the highest wattage laser in the city of Mumbai.
Yes.
It's a 150 watt Jena German laser. And we're able to use it to do all these surgeries without making any incision on the patient.
Yes.
We do everything endoscopically through your natural orifice. So through the urinary meatus, we go in, reach the stones and manage. Apart from stones, we also specialize in malignancies. So kidney cancers, bladder cancers, prostate cancers, they form a bulk of our practice here. And we do all these surgeries with robots. In fact, today we are doing 2 kidney cancers, both robotic surgeries, where we're going to just remove the tumor and preserve the rest of the kidney. So the patient can have his kidney preserved.
For kidneys, you have kidney cancer.
Yeah, you can have kidney cancer.
I've only had a prostate cancer.
No.
Which I feel it's
In fact, you have a lot of patients with kidney cancer, with bladder cancer, with testicular cancer, renal cancer. All of them are handled by urologists.
Yes. Wow. Thank you, doctor, for this part. I know you have done so many part of the stories and good track record on treating cancer. Let's go to male reproductive health.
So we also look at a lot of male andrological problems. Like we always hear the problems of menopause and hormonal changes in women. Males also can get such problems. So
we
that
have menopause.
Yeah, it's called as andropause. The male menopause is known as andropause. In males also, as we age, our testosterone level goes down and we start developing symptoms, which we treat along with our endocrine team here by giving them testosterone replacement and by doing their full evaluation.
Yes.
So we deal with all problems of male infertility, male andropause, and male sexual health. All these issues are sorted by us.
What about erectile dysfunction?
Yes, of course, we treat erectile dysfunction as well. We do all sorts of procedures, including diagnosing, treating with medicines, injections, and worst case, if you need, then we can do an implant as well.
Which implants?
So we do typically an AMS implant, which is an artificial sort of device where you can, with the press of a button, inflate it on demand. And then when the job is done, you can deflate it and it goes back on. Yes.
Using electricity or using
No. So this is not electricity based,
yes.
but it uses a special fluid which basically then enters into the implant and provides the rigidity you need for intercourse.
I've never heard of male implants.
Yes, of course.
From a natural male implant, is there one?
So we have some low cost options also in India, because all these artificial implants are quite expensive. So we have an implant which is designed by our head of andrology, Dr. Rupin Shah. It's called as a Shah's implant. So that does not involve any major expenditure.
Yes.
And the implant can be it has a hinge with which you can take it up or you can keep it down. So that also is a very reasonable, cost-effective option for, say, the Asian and the African subpopulation, where cost can be a big factor.
Okay, doctor, I've heard of kidney transplant, liver transplant, pancreas transplant, and heart transplant. Can a male or a man donate his part, reproductive organ to another male?
No, that hasn't yet been done, because again, like I said, all these other organs which you talked about are required for life.
Yes.
You cannot live without a functioning liver, a functioning kidney, and a functioning heart.
Yes.
Whereas male reproductive organs, you are able to provide implants to give the function back to the male organ. So there is no need to transplant a male organ to another person.
We have artificial.
We
have artificial male transplants.
Yes, we have artificial devices which you can put.
Yes.
So you don't need to transplant.
Oh, great. Let's go to this topic of infertility.
Yeah.
Please tell us.
So infertility could be because of multiple reasons. Sometimes a lot of people have pre-existing illnesses like varicocele, which can be treated with surgery. Yes. Or they can be sometimes having a very low sperm count, which can be treated with medicines. Yes. So all these things we do here. We have a very good team here which manages the infertility, and we are happy to take care of patients having infertility issues as well.
Yes. In most cases, I've had men always blame women for infertility.
No, so they need a full evaluation. It is always a two-way game. Yes. It is never one person's fault or another person's fault. And we have to evaluate both by the gynec. The female is evaluated by the gynec, the male is evaluated by the urologist. Yes. And then we know what is the exact reason why they are not able to conceive. Yes. Once we know the reason, we treat it, and that sorts the problem.
What if the system of a male has totally it's actually infertile completely?
Then they need a special biopsy from the testes to see if they have any viable sperms. And if they have viable sperms, then those sperms are extracted and used for artificial reproductive techniques known as ARTs. So using those techniques, you can still conceive. But for that, you need viable sperms in the testes.
Yes.
So that we can diagnose with biopsy and then we can give them the desired result.
So,
but again, if
a completely dead production of sperms,
you can have sometimes patients develop conditions which lead to damage to the testes, yes, and then there is no activity. In those cases, then there are two options. You can either get sperms from the sperm bank and raise the child as your own, yes, which is also a noble thought, and or they can always adopt.
Now, Doctor, let us talk about this issue of male organ. Yeah. Penis.
Yes.
What are the main diseases?
So, penile diseases can vary from infections, from phimosis where the skin does not come back, to malignancies, which are very rare. But yes, when they occur, they need excision of the male organ, Whether it's partial or total depends on how aggressive the disease is. Sometimes it spreads to other systems. Then you may need another surgery, or you need chemo or radiation to control the disease. But yeah, overall, these are all different things which can affect the major organ.
Can you reconstruct a penile?
Yeah, you can. You can. Sometimes, if it's a very disfiguring surgery, which leads to a crippled organ, you can do plastic surgery. We have a very good plastic surgery team here, which works along with us to sort of give you back the knee organ as close to what God made it up to be.
Another good question. So many people suffer bedwetting.
Yeah.
How do you advise them how to treat this condition?
So bedwetting is a situation which varies by age. When you have bedwetting in children, we teach their parents to keep alarms, make them go to pee at a fixed time so that they don't bed their beds later. In adulthood or later in life, then we need to find out what pathology, what problems are causing. There could be hundreds of causes. We find the cause, we treat the cause, we control the problem.
Yes. So it is treatable medically or surgically?
No, it is always medical management. There is never surgery required for bedwetting.
Okay, that's good. Do we have cancer of bladder?
Yes, it's in fact one of the most aggressive cancers known to humankind. And we do the entire procedure robotically.
Yes.
So if you have bladder cancer which is gone into the muscle, then the whole bladder needs to come out.
Yes.
We use intestines to create a new bladder, which is called as neo bladder. Or we can use a part of the intestine as a conduit and give you a new urinary passage after removing the bladder.
Yes.
That's the worst case scenario. In simple cases, when the tumors are small, we go with endoscopy and we remove the tumor and treat the problem.
Wow. Doctor, I've heard of blood hematuria. What is that?
So again, hematuria means blood in urine, and again, it means full proper evaluation. The reasons could be, patients have blood thinners, patients with infections, or patients with tumors.
Yes.
So we need to investigate that, get to the bottom of it, and then treat the problem.
Yes. Wow. Another question. Questions are so many.
No. I'm free. I'm happy to answer.
Good. In some cases, I've had men complaining, I cannot hold my urine.
Yeah. So typically, when you're not able to hold your urine, is a problem which happens in elderly. And this happens when they've been suffering from prostate enlargement, when they're suffering from urinary tract infections, when they're suffering from weakness in the pelvic musculature. All these problems can lead to leakage of urine. Again, they need full proper evaluation by a urologist. And then we can treat it either with medicines or sometimes with prostate surgery.
Now, last question. We have kidney transplant.
Yes.
What helps you as a doctor? New technology, we have robot.
Yeah.
What helps you?
So for the longest time, we've been doing transplants for the last 20 years. We were doing an open transplant, where the patient would have a big incision to put the kidney in.
Yes.
We have been doing for the removal part of kidney, the donor-nephrectomy surgery. In fact, I've just done a transplant and I've come there. We remove the kidney by keyhole surgery. So that surgery is a completely almost zero pain, fast recovery, in 2-3 days patient goes home kind of surgery.
Yes.
We were not able to give the same advantages to the recipient because we did not have the requisite instrumentation till now.
Yes.
But you will be happy to know that we were the first team in the state of Maharashtra and in the city of Mumbai to do a robotic transplant back in 2018-19. And for the past 6-7 years, we have been doing a robotic transplant for our patients, where the incisions are smaller, chances of infection are less, and the recovery is much, much faster. So we are able to give the same advantages which the donor has to the recipient as well.
Yes.
And we have done the most numbers in the state.
Yes.
And we are happy to help patients with transplant. If need be, then robotic.
I have someone saying, can I sell my kidney?
No. That is illegal, unethical, and against the law. We do not do any illegal transplants. And I would not advise anybody to undergo something like that because an organ is a precious thing. Your body requires it. And you never know when you may become a kidney patient.
Yes.
So selling your kidney is never a good option.
Yes.
Should not be encouraged at all.
Yes.
Having said that, what you need to do is you need to be careful about keeping your kidneys in good health. How do you do that? By drinking at least 2 liters of water every day.
2 liters?
2 liters minimum. Depends if you are very heavy into gymming and you do hard work, you sweat a lot,
Yes.
then you may need to drink more, maybe 3 liters. But for the average human, 2 to 3 liters is enough. And you need to make sure that you don't hold your urine for too long. You go and pee from time to time every 2 to 3 hours. So if you keep all these in check, don't take medicine without asking your doctors.
Yes.
Don't take painkillers without asking your doctors.
Yes.
If you do all this, you keep your kidneys safe
Yes.
and you keep them sound. And you will not require a urologist then.
Yes. Wow, that's good. Doctor, what substances affect kidneys?
The ones I just described. Take painkillers, antibiotics,
Painkillers,
antibiotics, supplements. You don't know what goes in there.
Yes.
You take all these heavy metals.
Mhm.
All these can lead to kidney damage. So you have to avoid them.
Yes.
Don't take medications without asking your doctor.
Yes.
Yeah.
What about alcohol? Like wine,
Alcohol,
like whiskey?
alcohol, for the longest time, people used to think that having 1 unit or 1 glass of wine, red wine a day is good.
Yes.
But there have been enough studies now
Yes.
which clearly show that no alcohol is always better than any alcohol. So no alcohol is good for you. If you can be a teetotaler, nothing like it.
Yes.
But if you have to have and you just cannot stop,
Yes.
then having it in moderation,
Yes.
having not more than 1 or 2 units is the way to follow.
Wow, that's good. Doctor, last not least, why do you like working at GlenEagles Hospital?
Oh, that's a very good question. So I've been working here for almost 12 years and we have a very dedicated set of people who are highly trained,
Yes.
who are driven to give the best outcomes to their patients. And last but not the least, we have a management which supports all of this. So we buying cutting edge technology in terms of the best laser, the best robot, the best equipment which you need to treat human diseases.
Yes.
All the equipment which we have here is at par with whatever is there in the best centers in Europe or in the US.
Yes.
And we have trained with the best surgeons in the world in Europe and US. So we have all the technology which is available in the Western world
Yes.
at a tenth of a cost here in India, with a management which has the vision to take the hospital forward. So we are very happy to work here at GlenEagles, and we'll be happy to help you get your urological problems sorted.
Thank you.
Thank you.
Thank you so much for watching our special guest today. Wishing you good health. And if you have an issue, please don't hesitate to call us for specialized treatment. And you're going to get the best from GlenEagles Hospital. Thank you so much.
Thank you.